Hello, my name is Dr. Ravi Assomull. I'm a consultant cardiologist with expertise in both cardiovascular risk and advanced cardiovascular imaging. This includes cardiac CT and cardiac MRI. I'm also one of the founding partners of One Heart Clinic. I undertake advanced cardiovascular imaging. Broadly speaking, there are two types of advanced imaging: cardiac CT, which allows us to visualize coronary arteries and to see if there are early signs of plaque or potential serious narrowings in any of the blood vessels supplying the heart muscle. It is now the standard of care for patients who have chest pain, and we are fortunate to have access to one of the best scanners with the highest quality imaging concomitant with a very low dose of radiation. In a cardiac CT, patients will need to hold their breath on 4 occasions for just a few seconds to get all the images we need. We also use a lot of cardiac MRI in our clinic, as this is a unique method of assessing the composition of heart muscle. Cardiac MRI allows us to look for inflammation or scarring in the heart muscle. We often see scarring in patients who have had heart attacks or where we suspect viral myocarditis, which is inflammation of the heart muscle, something we've seen quite a lot of with COVID and actually with some of the vaccines used to prevent serious COVID infections. Cardiac MRI also allows us to assess the blood supply to heart muscles. A lot of information can be gleaned from the scan, which typically takes an hour or so. Using these two innovative imaging modalities together, we can confidently steer patients away from invasive procedures should the information we acquire be reassuring. Using the anatomical information from cardiac CT and the functional information from cardiac MRI, we can confidently identify which patients would really benefit from invasive procedures, and we can then justify the risks of the invasive therapy to our patients, as they know things have been looked at thoroughly and with the best technology. External review of our clinical data has confirmed we have a far lower rate of invasive therapies compared to our peer groups, with excellent outcomes for our patients.